Hello, can you hear me?
Yes.
Okay, so our case for today is something very important. It's called menopause. Like, so if usually if a patient present with hot flashes and menopausal symptoms after and she's above 50, so what would you do the first thing?
Mm-hmm.
Yeah, so the first thing you do, just you do physical exam. After the physical exam, what would you order? What do you think?
It's gonna be like a FSH.
Yeah, you can do that FSH, LH, and all of these CBC, CMP, but if you don't want to do it, that's fine. It's a clinical diagnosis. So you just
Yeah,
see the
probably.
history, hot flashes, and everything. It's a clinical diagnosis. There's no need for labs. So immediately after physical exam, you start treatment. So what do you think the treatment?
The treatment is depending on what symptoms the patient he has. Like,
Yeah. So this one, yeah, you're right. Like in real life, it's different in real life than the exam. So in the exam, this is what they want you to give her. Like you give estrogen, oral, continuous, and you give vitamin D,
so let's.
calcium, and consider ordering screening. So the screening is very important. After age 50, you gotta do mammogram, colonoscopy, and pap smear if she hasn't done haven't done one in the past 3 years. So for men, we're lucky. We just have to do colonoscopy, and that's it. Call it a day. But for women, they have to do mammogram, pap smear, and all of these stuff. And lipid profile too. It's a screening every 5 years. It's like that. Okay. So after you manage that patient, okay, you follow up in 1 month. Okay. After you follow up in 1 month, in 1 month, okay, the labs will be normal and the symptoms will improve. After that, the case will end at this time. Okay, so this is a very simple case that we started with. So, patient present with a postmenopausal symptoms. What do? You do physical exam, full physical, always at the office, full physical, and then you diagnose clinically once you have like they give you all the symptoms and signs of postmenopausal, and then after that you start management. Calcium, vitamin D, this is one thing important. You estrogen, this is important, and screening. Okay, three things: hormones, calcium, vitamin D, and screening, like colonoscopy, mammogram. This is very
Mm-hmm.
important. You will be graded on every single one of them, and then you send home and you follow up in 1 month. Okay,
Mm-hmm.
basically once you send the patient home and bring him back, the case will end. Okay, so this is
Yeah.
the case. Now let's just discuss if the case how if they change it. So this is our topic is not sometimes if they change it. This is how most commonly present. But what happens if they change it? So about the hormone replacement therapy, we give it only 2 to 3 years and taper down in 6 to 12 months to avoid symptoms rebound. Okay, but if there is a cardiovascular risk, you gotta pay attention to the history. If there is cardiovascular risk, deep vein thrombosis, stroke, breast cancer, intolerance to hormonal replacement therapy, what do we start her on? What do you think?
If she has all these stuff
Yeah, we don't.
and she's already on estrogen.
No, like so if she's having severe postmenopausal symptoms and she's having risk factors that we can't give her hormonal replacement therapy. So what do we give her to relieve her symptoms? What do you think?
Uh, maybe like to give her symptoms.
We give SSRI, we give SSRI,
Ah, yeah,
SNRI,
yeah, you're
okay?
right.
Or
Yeah,
gabapentin that we can use that too, okay?
yeah.
So these are the things may pay attention for that. Just if they change the case. So this is what I want you. This is the case. This course is designed to make you rock the CCS cases, and you never miss anyone. Okay. So because we'll discuss every time the situation changes. Calcium, vitamin D, obviously to decrease osteoporosis. And
Yeah, sure.
counseling is important. You gotta start that from day one. She come to you, so you get to counsel. You write that down: high calcium diet, low salt diet, medication compliance and adherence. This is with everything and medication side effects. This with every single case you give medication, and you counsel about hormone replacement therapy. Okay, so counseling is important.
Mm-hmm.
Now for differential diagnosis, these are the things that we think of if they change. It could be this, so just keep it in mind. If someone present with hot flashes, all these postmenopausal symptoms, it could be postmenopause, it could be pregnancy, it could be hyperthyroidism, and it could be hyperprolactinemia. So if you
Yeah.
suspect any of these, that's why you order TSH sometimes, you order FSH, LH, okay?
Mm-hmm.
TSHU, it's important. FSH, LH, you can do that too, okay? I don't think you're gonna
Mm-hmm.
lose points, but it's not necessary. If you don't want to order it, it's still fine. Okay, so this is about the case about the menopause. Okay, initially,
Menopause.
yeah, initially clinical diagnosis and you manage. It's a very simple case. Okay,
Mm-hmm.
so thank you so much for listening. I'll see you on the next case.